Thanks a lot for staying with us. All right, let's talk health now. Talking stress and hypertension. Now, these are the deadly duo that can have serious consequences on overall health. When you are stressed, your body is fight or flight response, and this kicks in, releasing stress hormones that increases one's heart rate and blood pressure. The temporary spike in blood pressure isn't usually a cause for concern, but chronic stress can lead to sustained elevations in blood pressure, increasing the risk of heart disease, stroke, and other cardiovascular issues. Now, joining us now to discuss the symptoms and strategies for managing stress and hypertension is the founder, Love for Health organization, Dr. Yusuf Harun. Thank you for joining us at this time. I want us to begin with, that part. Something stuck out for me in the introduction, talking about it's not exactly dangerous. Stress itself is not dangerous, but it is when it's at an alarming level or so that it now becomes something for you to be concerned about.
Yes, that is why hypertension is called a silent killer, because it doesn't show, or there's a misconception that it doesn't show any symptom. One of the precipitating factors is stress. There are all other risk factors to hypertension. And to curb stress or to manage stress well, it is good to follow some certain procedures. One of it is to rest well. Another is to exercise. And thirdly is that we should look for what is causing the stress factor and try to manage it, either due to psychological factors, social factors, physical, or some people just think maybe due to some economic factors, it could affect their stress. So we should always manage this stress well so that we don't have other complications. One of it is hypertension. There are all other things stress can cause in the body. For example, it could cause psychological conditions. People can go into depression, anxiety, bipolar affective disorder, and hypertension as we are focusing today.
Well, statistics says here that about 51% of men are hypertensive in Nigeria. What do you make of this, looking at the kind of stress men face in life?
About this 51%, I'll be, tell you, not happy to tell you this, but I'll be able to tell you that 20 to 60% of Nigerians are undiagnosed. They don't even know they have hypertension.
Okay.
So among these 51%, there are still more with hypertension, which could be due to stress, which could be due to their lifestyle, which could be due to hereditary, and they are unknown to be hypertensive. So about 28 million Nigerians don't even know they're hypertensive. Then about the 50% of men you said, or 51% of men, yes, more men have hypertension than women, but more women die from complications of hypertension than men.
How do you mean?
Thank you. Now, when we're talking of complications of hypertension, we could talk of major complications or minor complications. Major ones everybody has heard of is stroke. Men could have stroke from hypertension, but when a woman breaks down with stroke, she has a higher tendency of dying faster than a man with stroke.
Why is that?
The reason is that men have long-standing history of hypertension. Just like you have long-standing conditions of heart problem, the body tends to cope with it. So also, our body tends to cope with stress, which is unfortunate. But when we have a long issue of stress, we cope with it. But in women, when they have a stress, they have a higher tendency of breaking down faster than men. Some of these things are unknown. Some of it have been associated to hormonal factor. Is it due to the hormones of the men, testosterone, or is it due to the ones of the women, estrogen, progesterone, or is it just due to the makeup? So there are many factors that can affect this stress, and many factors can affect a man and a woman. But statistics show that more men have hypertension, but more women die from complications of hypertension.
So how often, Dr. Love, should Nigerians, both men and women, check their BP level?
This is a very, very important question. I would recommend that people check their blood pressure every month, monthly. And if you are not hypertensive, yes, if you are hypertensive, it is advisable that you even do it weekly. Or you can, and if it is something
Some
which
suggest
is
even daily.
Daily, that's what I want to say. And if it is something which is remarkable, which is very, very, very significant, you should do it daily. But if your blood pressure, for example, let's even start, when you are diagnosed with hypertension, your blood pressure is 140/90. It's above 140/90. That is suggestive of hypertension on 2 separate occasions using a SFIG. So we have 2 types of SFIGs. We have the electronic one and the manual one. The manual one is the ones that have been used in the hospitals for decades, using a SFIG with a mercury. The electronic one is the one you just put in a battery and everybody can do it at home. So if you can do it daily, it is the best.
So which one is advisable?
Now, because of electronics, there are some risks or there are some wrong readings in electronic devices, but some of them are close to accurate. I would prefer, if I use an electronic to measure your blood pressure on 2 separate occasions, I would prefer to use the SFIG. Even when I was in the US, I remember that in the hospitals, they still use the manual SFIG to measure their blood pressure, even though they can even have devices where they put on your arm and they just press a button and they look at it on the screen. But I would still recommend we shouldn't discard the manual completely.
All right. And with the way it's so pervasive in Nigeria, so how would you advise that one goes about it? Is it something that you feel government may need to bring some form of intervention? Because we have people in their prime. It's not just a hereditary issue now. We're having people, their lifestyle changes or their lifestyles are prompting this burden on them, which will eventually be a burden on the economy, on the country. So what's how would you advocate that we get out of this mess that we are in?
Now, almost everywhere in the world, there is usually a government role in managing health generally, and specifically managing stress with or associated with hypertension. 2 years when I practiced as a medical doctor in Saudi Arabia, their government provides free health care for them. So I wouldn't be surprised if their stress management is better than even the United States, where health is not free. They usually pay or you have to use insurance. So the government in Nigeria has a major role to play in managing stress and also in regulating the economy. One other thing they can do is to provide accessible health care. I was very happy and excited when I watched on the program that the government has provided free cesarean section to all pregnant women. This could reduce the stress of it. For those in need, that's another criteria. Who are in need? That is now another big question mark. But I believe strongly that the government has major roles to play in managing stress in the country.
What about the issue of food, your diet? Let's also speak on that, because you cannot wait forever for government to take action. And yes, you've spoken about your regular BP checks, but diet.
Yes, I was coming to this. We shouldn't always wait for government to do everything. What can we do for ourselves? In terms of diet, apart from stress, that's why I said there are some other risk factors. Diet is a major risk factor or a precipitating factor to hypertension also, not only stress. High salt intake is one of the leading causes of hypertension. That is increasing sodium intake in the food. So we should try and reduce salt. Alcohol is another one. Smoking is another one. Eating excessive fatty food, high cholesterol, hypercholesterolemia can also be associated with hypertension. Sedentary lifestyle, somebody just staying in a place throughout the whole day, not exercising, lack of exercise. We can go on and on. Then, as you said, hereditary and things like that, those ones we cannot control. So some people divide hypertension into essential hypertension and non-essential hypertension. So we also have modifiable ones and non-modifiable. Non-modifiable can be like, my dad is hypertensive, my mom is hypertensive. I have a chance of developing hypertension, but I can manage it with managing my stress, managing my diet, exercising, and doing all other things to make sure I don't have
Dr. Love, looking at this, there are some people out there that they wait for the symptoms. Because you said earlier that hypertension is a silent killer. So what are those likely symptoms that you will be facing or you'll be seeing that's a sign of hypertension?
I'll give you a clinical example of a patient I saw or I met. This patient just came from work and was having headache. Oh, it's just normal headache. Let me go and take Panadol or paracetamol. But the headache didn't persist. This patient kept on walking until the patient collapsed and was rushed to the hospital. Behold, the blood pressure was 220/110. Malignant hypertension, not even just severe hypertension, not just mild hypertension, malignant.
Could the person be saved?
The person developed stroke, unfortunately. So the symptom you are asking for...
And this is a young person, it's not exactly...
Mid-40s.
Wow.
2 cases. A man, that man he survived and is going to be using drugs for life. When I was in the US, I saw this person. He's a Nigerian also. And we were speaking like, we don't always check our blood pressure. We are always used to it. So the woman, unfortunately, as I said, she developed the stroke. She had, we call it one hemorrhagic stroke. Hemorrhagic, where that is from hemorrhage, blood bleeding into the brain, and she died. That's why I said complications in women are usually worse when it happens.
All right, Doctor, unfortunately, we've run out of time, but this is an ongoing conversation, and we hope to bring you soon for more, to elaborate more on how to manage this major health concern. Thanks a lot, Dr.
Thank you very much.
Yusuf Harun.
It's a pleasure having you
your
this morning.
Thank you.
Right, you're watching TVC Breakfast Saturday. Up next now is our spotlight on the entertainment world with Theophilus Elama and Banky Oduni. Stay with us.